Morning, Marissa. So, what are we going to be doing for your patient today?
A pneumococcal pneumonia vaccine has been prescribed for my patient. She's 68 and hasn't had the vaccine in the last 5 years. It's to be administered via intramuscular injection at the deltoid site.
And what can you tell me about giving medication using the intramuscular route?
Intramuscular injections deliver medication through the skin and subcutaneous tissues into muscle tissue. Muscles have bigger blood vessels than subcutaneous tissue and more of them. So the intramuscular route allows for faster onset of action than the subcutaneous route.
Correct. The intramuscular route is chosen when a reasonably rapid systemic uptake of the drug is needed by the body and when a relatively prolonged action is required. What length of needle will you use?
Needle length should be based on the site for injection and the patient's age. Patients who are obese may need a longer needle, and emaciated patients may require a shorter needle. In this case, the patient is an adult. We're using the deltoid muscle, and she's medium build. So the needle should be 1 to 1.5 inches long.
Well, what about the needle gauge?
Appropriate gauge is determined by the medication being administered, right?
Right.
Well, then we will be using a 20 to 25 gauge needle.
Right. Some medications are packaged in pre-filled cartridges with a needle already attached, but you would need to confirm that the provided needle is appropriate for the patient before use.
And if it's not?
Well, then you must change the needle or transfer the medication to another syringe with the appropriate needle attached.
Okay, got it.
Good. And at what angle are intramuscular injections administered?
90 degrees, perpendicular to the skin surface.
Right. Now, what is the volume of medication that can be administered intramuscularly?
Well, it varies based on the intended site. Generally, 1 to 4 milliliters is the accepted volume range. And I think I remember that no more than 1 to 2 milliliters should be given at the deltoid site.
That's correct. Also, in elderly people and children, the appropriate volume of medication for any intramuscular injection is usually limited to 1 to 2 milliliters because people in these age groups tend to have less developed muscles.
Okay.
And as always, we need to use the 3 checks and the rights of medication administration to ensure patient safety. Any questions or concerns?
No, I'm ready.
Okay then, let's go prepare the medication and then see your patient.
Okay. Mrs. Black, how are you doing? Remember me? I'm Marissa.
Sure, I remember you. It's hard to keep track, though. There have been so many people in and out.
Well, here's another person I'd like to introduce you to. This is Mr. McDaniel. He's my instructor.
Hi. Nice to meet you.
Nice to meet you as well.
So, Mrs. Black, I'm here to give you your pneumococcal pneumonia vaccine. That's the one your doctor described to you that lowers your risk of getting a certain kind of pneumonia. The vaccine is recommended for people over the age of 65. Your doctor had you sign a consent form?
Yes, I signed it. I know pneumonia can be bad for older people, but I didn't know there was a vaccine to help prevent it.
Right. So we give this as an injection in your upper arm, okay? Can I check your ID band? Good, thanks. And your name is?
Iris Black.
And your birth date?
June 30th, 1942.
Okay. I'll just scan your ID band. Thanks. I don't see any allergy band on your arm. Any allergies?
I sneeze sometimes when I see a really bright light.
Well, that's interesting, and fortunately doesn't affect your receiving this medication. I guess you try to avoid staring at lights?
No, but if I feel like I have to sneeze, I know how to make it happen.
Wow, sneezing on demand. No allergies, though. That's good. So any questions before I get started?
No, let's please just get it over with.
Okay, Marissa, why don't you tell me what you're doing as you're doing it, please?
Sure. First, since we already checked the medication label 2 times when we prepared it, I check the label with the medication administration record for the 3rd time and I scan it. Next, clean gloves on. Then I select the appropriate administration site, in this case, the deltoid site.
Remember, Marissa, move the gown so you only expose the area you're using.
Got it. I'm just going to push your sleeve up a little, Mrs. Black.
Now, to avoid complications, Marissa, you need to be able to identify anatomic landmarks and site boundaries for the injection.
Okay, so with my left hand, I place 3 fingers below the edge of the acromion process of the scapula.
Now, remember you want to use the Z-track technique.
Right, so being careful not to touch the cleaned area, I move my hand a little to the right, then shift the skin and the tissue slightly to the left. I end up forming a triangle 3 fingers below the acromion process, with the point of the triangle on the mid-axillary line. The injection site is the thickest part of the muscle over the mid-axillary line. Looks good. Now I'll clean the area with an antimicrobial swab.
Okay, Marissa, remember to use a firm circular motion moving outward from the injection site and allow the area to dry.
Okay, while we wait, I'll get the medication ready. I remove the needle cap using my left hand because I'm right-handed. And I hold the syringe in my dominant hand between thumb and forefinger. Now I will quickly inject the needle at a 90-degree angle. This will just be a little pinch. Ready, Mrs. Black?
Okay, go ahead.
I carefully move my finger to the end of the plunger to avoid moving the syringe. Now I slowly inject the medication at a rate of 10 seconds per milliliter, right?
That's correct, Marissa. And wait 10 seconds after it's instilled before withdrawing the needle.
Okay, when I'm done, I'll withdraw the needle smoothly and steadily and at the same angle it was inserted. And it's out. I remove my left hand, releasing her arm. I'll put some pressure on the site with some gauze, but I won't massage.
Good, Marissa. You avoid massaging the site because that can cause trauma and irritation to the tissues.
Right, as well as force the medication into the subcutaneous tissues. Okay, how are you doing, Mrs. Black?
Fine, I barely felt it.
Good, almost done. Let's put your sleeve down. And I'll discard the needle and the syringe into the sharps receptacle.
Good, Marissa. Now document administration of the medication in the computer. Since the medication was administered as an injection, what else do we need to include?
The site used for administration.
Good. And remember, if appropriate, you should evaluate the patient's response to the medication within the appropriate time frame. Now, in this case, we won't have an immediate therapeutic effect.
Right. Now, Mrs. Black, we're done here for now. Can I get you anything before we head out?
No, I'm fine, thank you.
Okay, just use the call button if you change your mind.
Thank you, Mrs. Black.